also must address the underlying condition. According to the classic teaching of traditional Chinese medicine, it is necessary to first carefully determine the patient's overall yin-yang condition. Yang conditions are then treated by regulating yin, and yin conditions are treated by regulating yang. A case history from the Ming Dynasty discusses a woman who suddenly sank into a coma. Her entire body became cold. There was no perspiration and no pulse could be detected. The woman remained unconscious for 3 days, but continued to breathe. Numerous physicians offered various prescriptions, but in her unconscious state, she was unable to take any medication. On the 4th day, the woman's family called in the eminent physician, Zhou Shenjai, to try to save her life. Dr. Zhou reflected that if a person is without a pulse for several days, the result must be death. But this patient was still alive after 4 days. He concluded that this was a case of a heat condition reaching its maximum, producing cold symptoms. What appeared to be cold was actually extreme heat. Dr. Zhou covered the patient with wet cloths in order to cool the underlying heat condition. Within moments, her body started to warm up, and shortly after, she regained consciousness. Complaining that her mouth was dry, she drank 5 or 6 bowls of cold water and immediately started to sweat profusely. Only at this point did Dr. Zhou prescribe medication. After taking the medicine, the patient recovered completely. Yin-Yang Theory provides the theoretical framework for every aspect of traditional Chinese medicine, including physiology, pathology, diagnosis, and treatment. Without the principle of yin and yang as a guide, it would be impossible to navigate the mysteries and complexities of traditional Chinese medicine. The third fundamental principle of traditional Chinese medicine is 5 elements theory. 3,000 years ago, King Wu of Zhou had just completed his conquest of the Shang dynasty. The land was in a state of turmoil. Troubled, King Wu sought the counsel of Ji Zi, a deposed minister of the Shang court. Ji Zi told the king about a plan of government developed by the legendary Emperor Yu. The first part of Emperor Yu's plan was based on the 5 elements and their interactions. The principles of the 5 elements is discussed in detail in the ancient historical document, the Book of History. The 5 elements consist of wood, fire, earth, metal, and water. 2,500 years ago, traditional Chinese medicine's 5 elements theory was recorded in the Yellow Emperor's Classic of Medicine. Only then were the mysteries of this profound concept fully revealed. According to the Classic of Medicine, all things in the material world are composed of the 5 basic elements of wood, fire, earth, metal, and water. The 5 elements also represent the functional attributes of all material things. The natural world is a macrocosmic system that is composed of these 5 elemental categories. Human beings are components of nature. Therefore, the 5 zang organs of the human body embody the 5 elements on the microcosmic scale. The liver corresponds to wood, the heart corresponds to fire, the spleen corresponds to earth, the lungs correspond to metal, and the kidneys correspond to water. The relationship among the 5 elements follows a cycle of mutual generation and inhibition. Wood engenders fire, fire engenders earth, earth engenders metal, metal engenders water, water engenders wood. Wood inhibits earth, earth inhibits water, water inhibits fire, fire inhibits metal, metal inhibits wood. Mutual generation means that the elements promote and stimulate each other, signifying a mutually sustaining relationship. Manual inhibition means that the elements control and subdue each other, signifying a mutually restraining relationship. This principle is widely applied in the clinical practice of traditional Chinese medicine and is key to its effectiveness. The principle of the 5 elements is fundamental to traditional Chinese medical theory. An understanding of 5 elements theory is essential to unlocking the riddle of traditional Chinese medicine. Without 5 elements theory, the classic of medicine would not exist, and there would be no theory or clinical practice of traditional Chinese medicine. It may be said that traditional Chinese medicine represents the medical application of the principle of the 5 elements. Wu Zhutong was an eminent physician of the Qing dynasty. One of his case studies discusses a 24-year-old patient who presented with pain in the right ribs. The patient described the sensation as a hard lump constricting the chest, dull pain, coughing, shortness of breath, and severe weakness. Dr. Wu applied 5 elements theory to treat the patient. The spleen and stomach correspond to earth, and the lungs correspond to metal. Since earth engenders metal, Dr. Wu supplemented the spleen and stomach in order to treat the lungs. After the normal functioning of the lungs had been restored, the symptoms of coughing and shortness of breath naturally disappeared, and the patient made a full recovery. The Chinese ancestors had no diagnostic instruments. How then were they able to recognize pathological changes in the organs of the human body? Traditional Chinese medical theory holds that although the 5 zang organs are hidden deep within the body, changes in their functioning are reflected along the meridians, the body's network of energy channels, as well as their corresponding external organs. By examining signs in the external organs, it is possible to understand the condition of the corresponding internal organs. This theory has been proven by 2,500 years of clinical practice. The classic correspondence are as follows. The heart opens to the tongue, the liver opens to the eyes, the spleen opens to the mouth, the lungs open to the nose, the kidneys open to the ears. One case history from the Song dynasty discusses a 30-year-old patient surnamed Zhang from Shanxi province. Zhang suffered from severe itching in both ears. He generally experienced 1 episode a day, so intense that it was unbearable. He would use any available implement to dig in his ears until they bled. Only then could he gain a modicum of relief. Over time, this affliction took a huge toll on Zhang's overall health. One day, the eminent physician Zhou Min happened to be passing through the area, and Zhang begged him for help. Dr. Zhou diagnosed Zhang's condition as weak kidneys, which were not effectively excreting waste. As a result, toxic qi was attacking upward through the meridians. The kidneys opened to the ears, so Zhang was experiencing symptoms of itching in the ears. Dr. Zhou prescribed medicine for Zhang and gave him strict instructions to refrain from meat and alcohol for 1 month. Zhang followed Dr. Zhou's instructions, and within several days the itching in his ears stopped. Traditional Chinese medicine is probably the only medical system to discuss in detail the relationship between emotions and the functioning of the organs. The Yellow Emperor's classic of medicine may be described as the forerunner of today's science of psychosomatic medicine. It includes theoretical discussions and specific analyses of the relationship between psychological factors and physiology, pathology, diagnosis, treatment, and prevention. Its conclusions may be crystallized into 2 principles. First, pathology of the internal organs leads to pathology of the psyche. Second, excessive emotion leads to pathology of the internal organs. According to 5 elements theory, the 5 emotions are directly linked to the 5 organs. Joy corresponds to the heart. Anger corresponds to the liver. Anxiety or thought corresponds to the spleen. Grief corresponds to the lungs. And fear or shock corresponds to the kidneys. First, let's consider how pathological changes in the organs can lead to psychological problems. Traditional Chinese medicine considers mental illness to be a function not of the brain, but rather of the organs. In clinical practice, when treating mental illness, it is necessary to first harmonize the 5 zang organs. Once, when the eminent Yuan dynasty physician Zhang Zihe was passing through Bozhou, he encountered a woman who had come down with a strange laughing sickness. She would start laughing for no reason at all and be unable to stop. This had been going on for 6 months. Many doctors had tried to cure her, but to no avail. After examining the patient, Dr. Zhang heated up a block of salt until it was red hot, let it cool and ground it up. He added several ounces of the salt to a bowl of river water and heated it until it dissolved. He had the woman drink the bowl of warm salt water and then induced vomiting by putting a hairpin down her throat. The woman vomited up 5 litres of dark yellow mucus, indicating a heat condition. Not long after, her uncontrollable laughing stopped. Dr. Zhang explained that joy correlates to the heart. The woman's condition was the result of excessive fire in the heart, which produced uncontrollable laughing. Now let's see how excessive emotion can lead to pathological changes in the organs. According to traditional Chinese medicine, every disease is caused by problems with qi. Excessive anger causes upsurge of qi. Excessive joy slows the circulation of qi. Excessive grief causes qi to dissipate. Excessive fear causes downward movement of qi. Excessive shock totally disrupts qi, and excessive anxiety causes stagnation of qi. Many diseases are caused by emotionally induced qi disharmony. Excessive emotion can disrupt the normal functioning and balance of the organs, leading to pathological changes. In extreme cases, violent anger can damage the body's yin, and violent joy can damage the body's yang, with life-threatening consequences. Anger damages the liver, joy damages the heart, anxiety damages the spleen, grief damages the lungs, fear damages the kidneys. A case study from the Qin dynasty concerns a scholar who became extremely angry when he lost a lawsuit. The resulting downward movement of qi caused him to vomit large amounts of blood and eventually lose consciousness. Eminent physician Qi Binghui happened to be travelling through the area and was called in by the scholar's family. The scholar's brother, who knew a little about medicine, asked Dr. Qi if he was going to prescribe medicine to stop the bleeding. Dr. Qi replied that this would not be appropriate. He explained that to forcibly stop the bleeding at this time would result in stagnation of qi, causing the patient even more distress. The brother then asked if he would prescribe medicine to supplement the lost blood. Dr. Qi replied that this would not be appropriate either. Supplementing blood at this time would cause unbearable pain in the patient's chest. The brother then asked, "Dr. Qi, if you are not going to stop the bleeding or supplement the blood, what treatment would you plan to use?" Dr. Qi explained that the patient's great anger had produced excessive qi in the liver. The resulting upsurge produced qi blockage in the chest, causing him to vomit blood. Only by addressing the qi disharmony in the liver would the patient recover. Abnormal psychological functioning can cause severe damage to human life. Traditional Chinese medicine effectively treats mental illness by applying 5 elements theory and the principle of mutual generation and inhibition. This process is known as using emotion to conquer emotion. That is, an appropriate psychological state is stimulated in order to counter an existing psychological pathology. According to the classic formula, fear conquers joy, joy conquers grief, grief conquers anger, anger conquers thought, and thought conquers fear. case history by the eminent Yuan dynasty physician Zhang Zehe concerns a wealthy woman who had been having trouble sleeping for 2 years. She had seen a number of doctors and taken many types of medicine with no improvement. The woman's suffering was intolerable and was affecting her husband as well. Numerous doctors had told her that there was no medicine that could cure her condition. Finally, the woman's husband asked Zhang Zehe to come treat his wife. Dr. Zhang was a noted master of 5 elements theory. After examining the patient, he determined that her condition was caused by excessive anxiety. He told the husband that they must think of a way to enrage the patient in accordance with the 5 elements principle that anger conquers anxiety. The two of them came up with the following plan. The husband prepared a sumptuous meal with Dr. Zhang as the guest of honour. The husband and the doctor then proceeded to stuff themselves in front of the wife, laying waste to the table like ravenous wolves. As the wife watched, their boorish behaviour caused her to become more and more angry. However, Dr. Zhang determined that the woman was not yet sufficiently enraged, so he went into her room and started rummaging through her jewellery. This was finally too much for her, and she started gesticulating and cursing at him. Amazingly, that night, the woman felt drowsy. She fell asleep as soon as her head hit the pillow and slept straight through for 7 days. After she woke up on the 8th day, she started eating and sleeping normally, and her condition was cured. Traditional Chinese medicine has followed a unique course of development based on holistic philosophy and the 3 fundamental principles of Qi theory, Yin-Yang theory, and 5 elements theory. Its application of the unique wisdom of the East has gained it worldwide recognition. Modern medical science is currently in the process of transforming from a purely biological discipline to one that integrates biology, psychology, society, and the environment. This new unified approach is very similar to the holistic principles of traditional Chinese medicine. As Eastern and Western perspectives on health and well-being draw closer together, traditional Chinese medicine's contributions to humanity will certainly continue to increase. It is possible that this brief introduction to traditional Chinese medicine has left you wanting more. After all, we have only taken the first steps in appreciating this profound subject. If you wish to deepen your understanding of traditional Chinese medicine, it will be necessary to boldly continue the adventure we've started here. We hope that this short documentary may serve as a signpost to help point the way.